Today, I'm serving up a morbid morsel, a bite-sized curiosity plucked from the shadowy corners of history. Short, strange, and just unsettling enough to stick in your teeth. London, 1846. The air in the operating theater is thick with the stench of sweat, blood, and anticipation. Wooden benches creak under the weight of onlookers, students, physicians, the morbidly curious. Down below, a young man is strapped into a stained surgical chair. His face is pale, eyes wide, but he doesn't scream. Not yet. Across from him stands a tall, broad-shouldered figure with piercing eyes and rolled-up sleeves. Dr. Robert Liston. Surgeon, showman, legend. He announces to the crowd, "Time me, gentlemen. This'll be quick." With a flash of steel, the blade descends. In less than 30 seconds, the limb is off. But so is something else. A cry, blood spurts, someone faints. An assistant clutches his hand, already going pale. And at the edge of the crowd, a man collapses, heart stopped dead. 3 lives, 1 surgery, a 300% mortality rate. The most infamous operation in medical history. Who was this man who wielded a knife like a duelist and left such a blood-stained legacy behind? Today, we take a closer look at the lightning-fast hands and complicated legacy of Robert Liston, the Scottish speed surgeon. Robert Liston was born in 1794 in Scotland, and he came of age during a brutal time in medical history. Surgery was more torture than treatment. There was no anesthesia, no antiseptic, just knives, saws, screams, and hope. In that world, Liston carved out a name for himself, literally and figuratively. He became known as the fastest knife in the West End. That wasn't just marketing. It was survival. A faster operation meant less agony for the patient, and sometimes a better chance of staying alive. It said he could amputate a leg in under 30 seconds. And yes, that was with a full sweep of blade and saw. Blink, and the job was done. But Liston wasn't just fast. He was theatrical. Picture this: a 6'2" Scotsman in a blood-soaked frock coat, gripping a gleaming Bowie knife, commanding a crowd of spectators like a conductor of screams. Some said he was more showman than surgeon. Others feared him like death itself. And then, of course, there's that operation. The one where he accidentally slashed off an assistant's fingers while amputating a leg, and caught a spectator's coat with the blade, making the poor man think he'd been gutted. The assistant died of sepsis. The patient died on the table. And the spectator dropped dead from fright. One of the few documented surgeries with a 300% fatality rate. But here's the thing about Robert Liston. He wasn't just a bloodthirsty blade man. He was a paradox. A pioneer disguised as a butcher. He was one of the first surgeons to care about cleanliness, long before germ theory was widely accepted. While others operated with unwashed hands and reused tools, Liston began championing the strange, radical idea that maybe filth wasn't good for open wounds. And in 1846, he made medical history. Robert Liston performed the first operation in Europe using ether anesthesia. A man who built his career on speed became one of the first to slow things down, to let the patient sleep through the pain. He didn't just cut faster, he cut deeper into the future of medicine. Robert Liston is often remembered for his accidents, his speed, and his spectacle. But look closer, and the story shifts. He lived in a world where pain ruled the surgical table, and instead of flinching, he leaned in. With a knife in one hand and a stopwatch in the other. He wasn't perfect. He wasn't always safe. But he was necessary. In a time before anesthesia, before antiseptics, before true understanding, he asked the right questions. He made the bold moves, and he forced medicine to change, even if it meant getting a little blood on the floor. And that, dear listeners, wraps up this Morbid Morsel. I'm your host, Thomas Gloom. And as you digest this nasty little treat, I know your hunger will once again grow. And when it does, I'll be back with more history for you to sink your teeth into. If you enjoyed this episode, please leave a review. And to stay up to date with the Morbid History happenings, follow us on Instagram at Morbid History Pod. Be on the lookout for the next full-length episode of Morbid History in 2 weeks. Until then, share this episode with some friends and stay curious.